All right. Well, thank you for having me. So there's a lot of information to cover with small ruminant health. So we're just going to kind of scratch the surface, and a bit of it's going to be kind of an overview, or let's see, there we go. So an overview of what we'll talk about today. So we're going to talk about just kind of the basic principles of disease control. And once we understand this, we can start applying these principles to various different diseases. And then we'll talk about herd health programs, how to approach those. We'll give some examples of common diseases that we encounter, what vaccine programs might look like in sheep and goats. And then we'll talk a bit about parasite control and keeping records. Okay, and like Dan said, if you have questions as we go, feel free to put them in the chat and we can kind of address those as we go. And if I miss them, then we'll definitely have some time for Q&A at the end. Okay, so when we think about diseases, it's important not to get it's easy to get really tunnel visioned and think just about, what we see in the animal and how that makes the animal sick, or if it kills the animal, or however that works. But what we want to remember is that there's more to this picture. So we want to think about the host, and not just how it impacts the host, but how the host can actually battle these pathogens themselves. So how resistant the host is to disease, or how susceptible. Then we also want to think about the environment that they're in and how that contributes to this disease process. So you could have the same disease in different environments behave very differently. So an example of that would be if you had a more contaminated environment or wet environment. So for different diseases, that might cause more issues because you may have a higher load of that pathogen, whether it's a bacteria, a virus, parasite, is going to change how that host pathogen interaction occurs. So then we talk about the pathogen or the bug, and you could have, let's say, foot rot, for example, or chlamydia that causes abortion. Same bacteria, they can have different virulence, or how much they cause disease in these animals. So the same bacteria, different strains, can have different outcomes with this pathogen host interaction. So we have all of these things kind of working together. So it's important to take a step back first and look at this big picture and see the various ways that we can approach these diseases to try to prevent them and control them if they do become an issue. Okay, so when we talk about host susceptibility, age can be a huge factor. So we typically think of young animals as being pretty susceptible to most diseases. Part of that is because they have a really brand new immune system, and stress is a big factor. So stress can be caused by handling events, but also weather, and we'll get into some of that a little bit later. Immune status, so whether or not they got passive immunity from that first colostrum, which is the first milk that comes out of the ewe when they're born. Nutrition status, and then whether or not they have had diseases in the past. So for example, if they had a really bad pneumonia and were able to recover, typically because of how ruminants' lungs are, they tend to scar. So they may have recovered from that pneumonia, but in the future, they may be more likely to get pneumonia again, or if they do get pneumonia again, it impacts them worse than it would have any other animal, if that makes sense. And then stage of production. So if you have pregnant animals, they may be more prone to certain diseases, or lactating animals, and then what their genetics are. So there's certainly between breeds, or even within a breed, you can have a lot of variability about host susceptibility to certain diseases. Okay, so we kind of talked about this. There's pathogenicity, and that's basically how this organism causes disease. It is that the genetic component of that organism. So as we know, we all have bacteria everywhere, and they're not all bad bacteria, right? So that the pathogenicity is what kind of separates good bacteria from bad bacteria. And then the virulence, even within, let's say, a bad bacteria or pathogen, there can be different levels of virulence. And for an example right now would be like with COVID, we're seeing different variants of the same virus that is pathogenic. They have different levels of severity of disease. So that would be the virulence. Drug susceptibility patterns can be different between different species of pathogens, but also even within a species, whether if they have genetic resistance to antibiotics or something like that that they've acquired, that can change how that bacteria behaves when we try to treat animals. And then they can have very different modes of transmission, which we'll cover a little bit later. And then with host pathogen interaction, we can get different outcomes, different types of diseases. And then some pathogens tend to be more chronic, so they persist in that host for a long time. On the environment side of this disease triad, there are some factors that we have no control over, right? So, you know, certainly there are regional diseases. So on the West Coast, we have diseases that are a little bit different than diseases that occur on the East Coast. For an example of that would be the types of blue tongue that we see on the West Coast would be a little bit different than the types of blue tongue that they would have on the East Coast, which doesn't really impact us very much since we only have one vaccine that is only for one type of blue tongue. So we're all kind of in the same boat there. Insect vectors may be a bit different. An example of that would be ticks. And then wildlife reservoir species. So another example of that would be on the West Coast, we don't really have the white-tailed deer, and they carry the meningeal worm, which is a big problem on the East Coast with small ruminants. And so we're very fortunate on the West Coast that that is not an issue because we don't have that reservoir species here. Climate, again, we can't control that at all. We can try to manage how we respond to certain climate changes. So that would be something that maybe we can try to plan for. And then the disease viability within the environment. So we'll talk about a few examples about how we think about certain diseases that can persist in the environment, or not diseases, sorry, certain pathogens that can persist in the environment. And at certain temperatures or with certain moisture levels, those pathogens can die, which can be very helpful because it helps minimize pasture contamination and things like that. Okay, things that we can manage is animal movement between herds to a degree, and then animal cohorts, so how we group our animals together. You know, maybe we have a older herd that might be losing weight, and so we manage them a little bit differently than we have our younger animals, or within our lambing or kidding groups, we might group them in kind of 2-week bundles so that the older kids or lambs aren't exposing our really young kids or lambs to certain diseases. And then transportation, there's a lot of resources on kind of low stress handling and transportation, and then stocking rate and density. So those, I think it's important to understand the difference between those two things. So stocking density is kind of literally the concentration of animals within a space. Stocking rate has a little bit more to do with how long animals are in that space over a period of time. And that is important when we're talking about pasture management and exposure to certain diseases. Okay, and then the types of shelters we can provide, and then how we manage the hygiene of their housing. Okay, so usually when we're thinking about diseases that affect our herds and flocks, typically we're really stressed about the diseases that, we find animals that are dead or, obviously really sick. It's important to remember that a lot of these diseases really impact how our animals perform. And so we may, it's a more challenging piece of the puzzle to kind of appreciate and measure. But hopefully this kind of helps us understand how this plays out. So with certain diseases, most diseases, we get a reduction of feed efficiency or just resource utilization. And that can be because of reduced feed intake. They can have, depending on the disease, they may have decreased nutrient digestion and absorption, especially if it's a disease that affects their gut. They can have loss of protein through their gut, through their kidneys, wherever this disease processes. Inflammation tends to kind of leak proteins everywhere. And then because these disease processes require energy, we get an increase in nutrient demand. So you can have animals that start to lose weight. They can have decreased production, so it's milk production. That can not only impact dairy animals, but will also impact animals that are lactating to raise kids and lambs. You'll see a reduction in growth rate of their young stock as well. And then you can also decrease carcass quality and wool yield. And then obviously we can also have death. Okay, so managing these infections, there's a number of ways that we can approach these as far as disease control goes. We can focus on prevention. And then if we have diseases in our herds and flocks, then we might shift to control. And then depending on what our goals are, we may decide that this is something that's really important to us to eradicate from our animals because of maybe it would give you market access, or maybe you have, anyway, it would have to fit with your goals, but there might be reasons that you would take a different approach as far as actually going to eradicate certain diseases. Okay, so kind of the basic principles of control is first and foremost diagnosing infections or diseases and possibly treating them if they're treatable. Not all diseases are treatable, but really important to understand what we're dealing with so that we can take a targeted approach. And then minimizing infection pressure. And so that's going to depend on the route of transmission and the source of infections. And then potentially improving the host response. And this could be through vaccines. It could be through immunomodulators. There's certain different ways to approach improving a host response to disease. And then trying to prevent new infections, and that might be through environmental management, movement patterns, things like that. We'll talk about a few examples. And then potentially another option is kind of moving that trend towards genetic selection for disease resistance. There's a couple of ways to approach this. One way would be to try to keep really good records, and we'll talk about this at the end, and selecting for animals that tend to need fewer treatments or things, like they do better in your system. So we're always thinking about breeding a better animal as we go. And then other options are genetic tests. So there are a few genetic tests for sheep and goats looking at disease resistance. So I love this quote. I first heard it from Dr. Lyle George. He was a internist at UC Davis, and then Dr. Angelos uses this quite a bit. So we miss more by not looking than by not knowing. And a lot of that is just really knowing your animals. And I've found that most of the clients that have come to me in my career know their animals way better than I ever did. And, like they're individual qualities. They bring them to you or to the veterinarian because they know something's off. And so it's important to look at your animals often and know what is normal for your animals. And then the moment something is wrong, it kind of sticks out like a sore thumb. You may not know what it is, but you'll know it's not right. And that, I think that's kind of the biggest thing. The first, like we said, diagnosis is kind of the first key for disease control. And you can't get a diagnosis if you don't notice that something is not right. So really important to just get out there and watch your animals. So nutrition is really important. Yeah.
Rosie, just one thing I would add to that. I think that can't be stressed enough. And I think one of the challenges in particular with sheep is that they are so stoic that that you may not see something unless you're looking really closely. And so learning to see kind of those subtle symptoms and displays of discomfort are really important.
And it may not even be something that you see in the sheep themselves. It may be that you notice their water isn't as down, they haven't drank as much water as they normally do, or they haven't, they're not coming to the feed as fast, or, like really kind of nuanced things that you might notice if you're able to watch your animals. Great. So we typically think of nutrition as kind of the foundation for animal health. It's not only important for good growth, good production, but also the immune system, reproduction. Nutrition is critical for all of these kind of normal body functions. So we want to make sure that they not only have enough energy, but that they have adequate protein and micronutrients. And the ones that we tend to focus on are copper, selenium, and zinc. Iron is in there. And then calcium and phosphorus, making sure that they're in the correct ratio is really important, especially for male animals that we're feeding and maybe pushing to a higher nutritional plane, because we want to try to prevent urinary stones. Proper feed bunk management. So I put that in quotations because we may not all be feeding in bunks, but basically what that means is making sure that there's enough space per animal around a feeding system. So whether you're throwing hay on the ground, or if you're supplementing feed, or if you do have actual bunks, making sure that there's enough bunk space for every animal to eat at the same time. In bucks, they've shown that even the shape of these feed bunks can impact their feeding behavior, just because of their aggressive nature. So there's round feeding kind of mangers, and with those round mangers, they tended to fight more because they were looking at each other versus a linear bunk where they were all looking the same direction. So there's actually research on that, which I find really interesting. And then, just knowing the pasture and, just green grass may not be, I think, kind of Dan's covered this in his talks before, but you can have really washed out grass. You can have really concentrated, strong feed. So just kind of knowing how that changes with the different weather patterns is important.
Absolutely, and knowing kind of what the basic nutritional components of the pasture might be, especially protein levels. We can manage dry pasture by adding some protein to the diet, for example.
So body condition is a really important thing to kind of get comfortable with. Monitoring on your animals, it's a good indicator of what their energy intake is. It's not necessarily the best indicator of protein or micronutrients.
Rosie, I've got a really quick question on micronutrients.
Yeah.
Here real quick, and somebody's losing audio, so we'll try to speak up. But we've got a question from Jolene about whether blocks or loose mineral are better for goats in particular if their tongues aren't rough enough from a block. Do you have any experience with either of those?
Yeah, so kind of whatever they will eat is good. I've seen goats kind of basically chew the blocks. So blocks are okay. I think goats like loose mineral better, but some are picky and won't. So it's kind of it kind of depends on your animal. If you don't have many, it might be worth trying a few different ones. But yeah, they can be a little bit picky at times. But
My experience with using both in sheep is that they probably consume better on loose mineral. But from the standpoint of managing a pasture-based system where you've got animals out in the weather, the blocks seem to hold up better. And so we've actually transitioned from loose mineral to blocks and have not had any issues with consumption in that regard. Also have a question, Rosie, about kelp and whether that should be is a source of micronutrients. Should that be added to a micronutrient mix or a mineral mix?
yeah, so I think a lot of people use kelp for iodine, a source of iodine. There are other sources of iodine. So, whatever I think you have access to as far as meeting their iodine requirements is acceptable. Great.
Great.
And
Thanks. I'll let you
then,
go on.
yeah, no worries. Okay, so just a really quick, brief overview of body condition. First, we'll talk about with goats. In goats, it's on a scale from 1 to 5, and we also use 0.5 increments. And there's a video through Langston University that is developed through the American Dairy Goat Association with Langston University on doing body condition scores in dairy goats. Most healthy goats are between 2.5 and 4, and this can vary depending on where they are in their production cycle. And even like this example is in bucks, if they're in rut, they may be a little bit kind of more fleshed out. And then at the end of season, they tend to be a bit leaner. So, and that can be normal for one animal. So just remembering that throughout a year, their condition might change a little bit, but making sure they're kind of within that range of 2.5 to 4 is that happy place. Usually, some of these animals can have pretty good hair coats, so it might take clipping or actually putting your hand on the animal to really get a good idea of what their body condition is. Excuse me. And then in goats, we're looking at 3 areas. So the lumbar region, which is right over, let's see if I can highlight this, but there's let's see, can you see my mouse there? I don't know if you can see that, the little arrow, but so this is their lumbar region right over this little triangle here. And then their sternum, which is down here, and then their rib cage. So those are the 3 areas that we're evaluating on dairy goats specifically, because they do tend to carry condition a little bit differently. For sheep, we typically just focus on, no, I didn't change that part, sorry. We focus on their lumbar region. And a lot of that is just because they usually have wool on them. Even if they are haired sheep, they typically have a layer of wool over their top line. So we're usually having to put our hands over their top line to be able to feel for these different conformations or conditions. So there's a really good example through, I don't think it's through, this one is through Australia Animal Health, and they basically how convex, so this is basically taking a slice through the animal, looking down its spinal cord. So if you can feel that spinous process really well, then that would put them lower down on the body condition. And as that lumbar region kind of fills out, they get up a little bit higher on that score each time. And obviously, we're not clipping these guys.
And for the handful of folks that are coming on Saturday to the field day, we'll get some experience estimating body condition on sheep. It is something you have to do. It's not something you can do just by reading. You have to get good at it.
Yeah, it takes practice. And individuals might have different scores, but as long as you are consistent with your scoring, that's all that matters, because it's seeing those changes over time is what's important. Okay, so on to herd health programs. Dr. Rao said this at one point. She said, think of risk of disease transmission like buying lottery tickets for the lottery that you don't want to win. So with every activity and event or management decision you make, how many lottery tickets are you buying? I thought that was a really great example or analogy for disease risk and how we approach that. Because some folks might be a little bit more tolerant to risk because of the goals that they have for their herd. An example would be for a show herd, much like Dr. Rao has showed Toggenburgs. She has an open herd because they're taking animals to shows and commingling them with other animals. And they do what they can at the show to try to limit the risk of disease transmission there. But there is potential, and those animals come back home and could potentially expose animals there. And that's a risk that she's willing to take because those are the goals for her operation. So that kind of helps her think about how she's approaching disease control and prevention. Okay, so when we think about herd health programs, we're thinking about total sheep management. So kind of the big picture, annual programs, preventing not only acute diseases, so these events where we have lambs with scours or pneumonia outbreaks, but also these subclinical diseases that impact our animals and maybe we don't really see them outwardly. So we'll talk about some of those. And then improving profitability. So Dan recently put on this sheep business basics talk, and one of his slides from this talk was talking about how you can improve your profitability. And this one slide showed that improving the kind of your gross margin per unit would increase your profit. And so disease control or improving production is one thing that can help with that. It requires a willing sheep producer and a knowledgeable animal health advisor. And I like to think of that being the veterinarian that you like to work with. Okay, so again, recognition and treatment of disease is going to be that cornerstone that really helps us know what is kind of the greater risks for your herd or flock. And then confirming disease and then determining the cause. So we may recognize a disease and let's say we know it's pneumonia because of how that animal's behaving, because of the signs that we're seeing outwardly. If the animal dies, this confirming disease and determining the cause basically means getting a necropsy performed. This doesn't necessarily mean shipping the whole carcass to the lab. I know some of you are quite a distance from a diagnostic lab. It could mean performing a field necropsy and sending in samples for that test. Getting a confirmation really just helps us kind of plan an approach that's really targeted for this specific disease in the future. And then we would implement husbandry and management practices to prevent disease on an annual management schedule. So this was the example that was provided in that talk. And we'll kind of take this, and I did a little sketch of what that might look like with Dan's example flock. So we call them windows of opportunity. And it's basically any time that the flock is gathered. And if the flock isn't gathered for management practices at the moment, or you don't have animals yet that you're considering this, this is the time to start planning those. So usually we develop this plan with a veterinarian or your animal health advisor, and these should be reviewed annually. We're looking at reproductive performance. We're looking at conception rates, fetal losses, and lamb crop survival. There are sort of kind of older benchmarks that are acceptable for some of these rates of losses. It's a bit challenging because some of those are probably about 40 years old, and what was accepted then might be a little bit different now. Dan, do you have something to add?
I was just, when you're done, I was going to maybe share our benchmarks on those,
Great.
just so people kind of get a sense of what we look at.
Yeah. And then, yeah, and I can actually pull up what we had from that older resource through extension.
Yeah.
And then we're also looking at weaning weights and fleece weights, so measures of production performance. And so these windows of opportunity, I don't know if you can actually see my handwriting on this image, but basically we're starting at, let's see, we'll start here. So let's say we'll start our season with pre-breeding. So we have 30 to 45 days before these animals are bred. We might monitor body condition on all of them, make sure that we've removed the ones that we don't want to keep before breeding, vaccinate the replacements and the ewes before breeding if we're doing vaccines like that prevent abortion, and then performing breeding soundness exams on the rams. And then flushing is just increasing that plane of nutrition on these animals before breeding. And then we have our breeding period, post-breeding, potentially 65 to 90 days after, we would bring them together again and ultrasound these animals to see if they're pregnant. We could do body conditions at that time, sort them to, depending on the operation. I know this doesn't happen on your operation, Dan, but depending on resources and management styles, they could be sorted into groups depending on how many fetuses each animal has, and managed nutrition that way. It could be done by fetus count. It could also be done by age. And then breeding soundness exams on the males again at that point. I think another thing that I didn't add in here is you could also be doing famachas at the same time. So just think of these windows of opportunity as your chance to do everything that you can when the animals are gathered and you're doing corral work. And then pre-lambing, as we'll see this weekend, vaccinating pregnant animals so that they can kind of get a rise in antibodies that will then make it into their colostrum that will protect their lambs against these diseases that would be a high risk for your flock. Ewes can be dewormed at that point if they need it. Often ewes at the end of their pregnancy are more susceptible to parasites. So that would be a really important time to check famachas. And then potentially crutching ewes, which is shearing around their back end and around their udder if they have a lot of belly wool, so that their udder is clean when they have lambs. And then doing, in this system, examining their feet at this time is what works. And then we'll go on and, everyone may manage their lambs a little bit differently in this system. So it's recommended within 3 to 4 weeks to dock tails and castrate. And then lambs shouldn't really receive vaccines much sooner than 3 weeks anyway. So it's a perfect time to start their vaccine series. And then we have shearing, and then pre-weaning, we might consider coccidia control, again, vaccines and their boosters, and then deworming if necessary. So it's kind of one way to look at your kind of management system and when you can do these kind of preventative health events. Okay.
You want me to share benchmarks real quick? You want to go back to that slide just very briefly? And this is, I think, a really important way to look at when you've got sheep or goats in an area where you can do some of these other things to them, and kind of planning that system. We've actually written a lot of this down even at our small scale, which I think is helpful. So our benchmarks on conception rates, our target is a 95% conception rate. And that means we hope that 95% of the ewes do conceive within the 45-day breeding window that we give them. If we start seeing fetal losses, and by fetal losses, I mean abortions where we know a ewe aborted a fetus. If we get up above, in our operation, 3%, we're going to start being concerned, and we'll try to figure out what's going on. If we can get a lamb to live for the first 7 days of its life, we figure we can get it to weaning. And so a live lamb, we figure our death loss in our lambs is probably 3 to 4%. And that's almost entirely in the first week. After that, we expect them to survive. Our weaning weights in our system, kind of our benchmark is 60 pounds at 100 days. And then fleece weight is going to be really dependent on the kind of sheep that you have. We have a coarse wool sheep for the most part, with very little belly wool and very little leg wool. And so our fleece weights tend to be lighter than a Rambouillet or a merino that would have have finer wool and denser wool. Thanks, Rosie. Hope that's helpful.
Yeah, absolutely. And it's pretty similar to what they have from the early 90s.
Yeah.
So they had a conception rate of 90% in the 45-day window. So yours is better than that. And
there's
then
some great information on the Lamb Resource Center that the American Lamb Board put out. That'll kind of give you some benchmarks based. We look at our operation, even though it's small, as if we're kind of a range operation as opposed to a farm flock, but there's some great benchmarks in that information as well.
So I like this question about how important is it to wean? And I think that depends on where your lambs go from there. So if they're going direct to slaughter after that, then I think you're fine. If they're going to a feeding program after, it's kind of helpful to at least have them vaccinated and maybe getting a little bit of concentrate before, so that you know their rumens are really well developed so that they can consume forage well. So there's a bit of research, mostly done in calves, but looking at how the rumen, it takes quite a while for that rumen to really develop well, but we can accelerate that by adding grain. And it doesn't have to be corn, it can be barley, it can be oats, but any kind of concentrate that really kind of stimulates that rumen to develop those papilla that they need to digest and give that extra surface area for bacteria and all of that. So if they're going to a feeding system after they leave your farm, then it might be a good idea to at least introduce that kind of, whether it's creep feeding or even just feeding concentrates. I don't know. The ewes really need concentrates at that time. I guess it depends on how much condition they've lost with lactation, which is pretty standard. So I don't know if that answers those questions, depending on what you're.
The other thing the other reason that we wean, part of it's a feed resource for us. So we want the good feed to go to the lambs, and a dry ewe has much lower nutritional needs than a lactating ewe or a growing lamb. And so it allows us to utilize those lower quality feeds with the ewes and save the higher quality forage for our lambs. It also allows us to dry off the ewes more quickly because they go from lactating to going to rougher feed and no lactation demand. And I think that in our system helps with our with udder health, to dry them off more rapidly than have them continue to produce milk but not have anything nursing on them in our system is an important consideration. Good questions.
And I don't talk about bummer lambs at all in this, unfortunately. But bummer lambs or even dairy kids or lambs that are pulled from their dams, it's important to remember that concentrate, because we're weaning them a lot sooner than we would wean animals that are dam reared. And so adding that concentrate in even as young as 2 weeks can help their rumen develop. It doesn't have to be a main source of their nutrition, but just something that they're exposed to. It's in their rumen and helping their rumen to develop. And then as you approach weaning them, you kind of have a much more calculated way of weaning them, because you can decrease the amount of milk or milk replacer that you're providing them every week. So you would decrease that by a quarter each week, and then make sure that they have new feed available to them every day, so that it's enticing and that they're approaching it and they get more of their nutrition from that than the actual milk.
Just a time check in, Rosie, we're about, we got about 40 minutes left.